this was a project that actually started 3 years ago and that we took a while to do because it was bigger than anticipated and had to rerun our searches a few times. But the aim of this work was really to try to threefold. So one was to try to understand if anxiety and depressive symptoms and disorders are associated with migraine in children and adolescents. That was the big number one objective. Second objective was to understand if a child who has migraine or an adolescent who has migraine is exposed to anxiety or depressive symptoms or disorders, does that change their headache-related prognosis? And then the third question was, is exposure to anxiety, depressive symptoms, or disorders earlier in life associated with a higher risk of developing migraine later in the pediatric age group? And so what we did to try to answer these questions is a systematic review of the literature and meta-analyses. We ended up actually finding around 5,000 studies that we had to go through, which is why it took so long and we had to update our search a few times. And then we narrowed it down to 405 studies after abstract screening to read full text. And in the end, we ended up with 80 studies, which is a pretty big systematic review meta-analysis to look at. And 74 of those studies, part of a study at least, addressed the first objective, which is, do anxiety and depressive symptoms and disorders, are they more prevalent or not in children and adolescents with migraine? And so we were able to meta-analyze, I believe it was 51 of those studies, and the rest we just described because they didn't have enough data to come in, either published in the paper or even after contacting the authors. And what we found in those meta-analyses is that for sure, when you look at the whole body of literature put together, children and adolescents with migraine have a higher burden of both anxiety and depressive symptoms, so just at the symptom level, but also a higher burden of anxiety and depressive disorders, so crossing over that threshold where it's considered a disorder. And we actually found a moderate to large effect sizes for the symptom burden. So we found that anxiety symptoms had a large effect size as associated with migraine as compared to healthy controls, and depressive symptoms had a moderate effect size. And then in terms of the odds of having an anxiety or depressive disorder, they were approximately double for each of those categories when comparing children and adolescents with migraine to healthy peers. So that was the main big takeaway from the study. When we looked at our second and third objectives to try to understand, well, okay, now if we look at whether having those symptoms or disorders predisposes to worse outcomes if you have migraine or predisposes to an increased risk of migraine, it wasn't very clear because there were a lot less studies and they were all over the place. And so those questions are not yet answered. And I certainly don't want people to assume that we know that. For example, saying, well, you have anxiety or depressive symptoms, so that means your headache-related outcomes will be worse. We don't know that yet. And so the big takeaway really for clinicians is that there is definitely, I think, now this high level evidence to show that this patient population is at higher risk of anxiety and depressive symptoms and disorders. And we need to screen every patient with migraine who comes into clinic for this, because that would alter the treatment plan. And we also really need to advocate for access to mental health services for the patients who need them. And I hope that this data will help to support that, to show the need.